So we will now have a little look at getting breastfeeding off to a good start. Learning to breastfeed is something that you and your baby will do together, okay? You know, even mums that have breastfed other babies in the past will have to learn to breastfeed their new baby, because every baby is a little bit different. And all the midwives and the support workers at the hospital, on the maternity ward, and then the midwives when you get home, they're all trained to support you with breastfeeding, okay? There is nobody that can't do that. So if you are needing some support, it's a really good thing for you to tell staff that you need that. So if you haven't seen anybody for a little while, or you're thinking that you need to ask, then please do. That's what we're there for. It's really important to do this right from the beginning, because it helps you avoid problems. It helps you avoid things like sore nipples, sore or tender nipples, which can be a bit of a pain to get rid of, but it will also make you feel more confident as well. So feeling confident, less anxious about feeding in the early days. So we're just going to have a little think about an analogy here. Okay, so we're going to have a think about a triple jumper. Some of you may know who this is, and it's fine if you don't. But if we think about a triple jumper, this is an Olympic triple jumper. Is the run-up for that triple jumper, is it important? So thinking about that, the athlete has to practice the run-up. Okay, so he has to have learned this run-up. He wasn't probably very good at it when he first started, but he's got better and he's now got it down to a T. He knows his run-up. He has to make sure that his body is in the right place and he's using his body in the right positions. And he has to get it right for his jump to be effective, for it to be effective to produce a really good jump. How he performs that run-up is going to affect that jump, okay? The end result will be dependent. If he doesn't do his run-up right, he might have a no jump, or he might only jump a really short distance. So in short, that run-up basically is ineffective. His jump is not very good, and he could risk an injury if he doesn't do it right. So with that in mind, I want you to keep the triple jumper in your mind and think, positioning, is it important? Okay. So your baby has to learn and practice that run-up to the breast. And it helps if they're held in the right place and their body is positioned in an ideal way. It helps if their positioning is just right, really, because that will help produce an effective latch. So how you hold your baby in that run up to breastfeeding, latching at the breast, will affect the feed. And if the positioning is not ideal, your baby might not latch at all, or they might only latch with what we call a shallow latch, which we'll talk about later. But in short, the latch will be ineffective, the feed will be ineffective, and it might cause you pain, and it might potentially, in some worst cases, cause you some damage to the nipple, some trauma that is really difficult to get past. I know that's a bit strange. Thinking about a long jumper has nothing to do with breastfeeding, but it's just to remember how important the approach to the breast is. So there's 4 points of positioning we're going to talk about today. And these 4 points can help you to hold your baby in what we would say is maybe an optimal way, really, to help them latch at the breast, and so that they can get an effective latch. And it's a great starting point for you and your baby to practice that run up to the breast to help you achieve an effective feed. And it's just really while you're both learning and gaining confidence, and eventually you won't even think about these 4 points, you'll just do them. But I think in the beginning, it helps to just think, what do I need to do to set this up right? Okay. So what we're going to do is we're going to have a little look at positioning with your baby. So I've got my baby here. Okay. So one of the first things that I really want you to think about is that your baby has to be close to you when they're feeding. And you can relate this to yourself. You wouldn't want to be eating a bowl of soup with your chair pushed at arm's length away from the table. You'd want to get in there close, right up close to your soup, so that you can eat it without straining and having to lean forward. And it's exactly the same for your baby. They want to be close to you, so they want to be really close. I think what I'm going to do here is just stop that so you can see me a little bit bigger. So really we're thinking, so rather than holding your baby away from you and taking yourself down to your baby, get yourself nice and comfy and just bring your baby in close, and making sure that their bottom and their feet are nicely secure and they're supported, because babies don't like to feel vulnerable. So if their legs are left to dangle down, it could be that they feel a little bit insecure and they might be fidgeting around a little bit. So really bring your baby in close and tuck them round. I'm going to show you this in what we call the cross cradle position, but actually these 4 positioning principles, they will work in any position that you want to latch your baby in. But for the purpose of this demonstration, we'll just do it like this. So keeping your baby in nice and close. And the other thing is that the baby's head here at the back ideally needs to be free. Okay. Well, the reason that is that, well, there's a couple of reasons really, but one of them is that when your baby goes towards the breast, just literally prior to them latching on, they will naturally tip the head back. Okay. And that's so that they can get their mouth nice and wide. So they'll throw the head back unless you've got your hand there. If you have your hand here, they can't do that, okay? And it will possibly make them frustrated. It doesn't always feel very nice. And I always tend to say this at this point, is if you pop your hand on the back of your head and then push forward with your hand, it makes you want to pull away, okay? Because you can feel something pushing on the back of your head. So even if you attach your baby with the head free here, if you then bring your hand up onto the back of the baby's head, it will probably be that they will pull off the breast, okay, because they're pushing back against that hand at the back of the head. So what we would say is, whilst you've got your baby nice and close and you've pulled them and you hook them into your body, taking your hand at the base of the neck, okay, and you're leaving your baby's head nice and free here. What you're doing is you're supporting the head at the neck. And actually, if you think about it, it's not your baby's head that's weak. It's actually your baby's neck that's a little bit weak, that needs the extra support. So by putting your hand here at the base of the neck, you can provide that support to them, okay? So now you've got your baby close and you've got your baby's head free. The other thing when you look down at your baby to make sure is that their body and their head is in a nice straight line. The reason this is because if your baby has to turn their head, so if their neck and their body is not in a straight line here, it's really difficult for them to actually have a nice feed. If you think about yourself, if you were trying to take a drink, you would drink with your head and body straight. And it's exactly the same for your baby. You wouldn't try and take a drink with your head turned to the side because it's really hard to swallow. It feels really uncomfortable. Your breathing feels a little bit harder. And it's exactly the same for your baby as well. So your baby will go through it. I'll keep going through it with you. Your baby is nice and close. The head is free. The head and body is in a straight line. A good way to check when you look down is my baby's ear in line with their shoulder? Okay, if their ear is in line with their shoulder, then they're in a straight line, and that's a nice way for you to look down at. And the last thing on these 4 main positions to remember is you have to position your babies, when they come towards the breast, they have to come in with the chin and the nipple has to be in line with the nose. Okay, this is quite an odd one for you when you look down. You probably will think, but my baby is going to latch to my breast, so surely the nipple should be in line with the mouth. But actually, for the purpose of the latch and the mechanisms of the latch and the way that your baby moves towards the breast, they have to come in and tuck in with their chin, and ideally the lip needs to be about 3 centimeters away from the base of the nipple. Similar to your hand expressing, that kind of distance back where the milk ducts are, just here in the tissue. You aim your baby's sort of chin and lip into the breast here, and then we aim the nose towards the nipple and we let them have a little bit of a nuzzle. So we ideally kind of rub the nipple over the lip and the nose here, and it will encourage your baby to kind of go with a wide gape of the mouth. They throw the head back, which is what we've just talked about, and then when the mouth is wide, they come up and they come up and onto the breast. Now when they latch onto the breast, they will latch, try and do this so you can see, might have to come back a little bit actually. So they come in low, they open their mouth wide, and they will come up and onto the breast, and they will take the breast tissue into the mouth here. Okay, so we'll go back to the slides and we'll have a little look at those, and then we can have a look at some pictures of what that will look like for you. Okay, so close, like we've mentioned, head free, remembering that head free here, head and body in a straight line, so nice and straight, not having to turn the head to get their drink, and positioned nose to nipple, so nose to nipple, so that they can come in. The nipple will then point towards the roof of the mouth, so the direction of the nipple goes upwards towards the roof of the mouth, so that when the baby's on the breast, they're on the breast with the nipple in the soft palate. If they go on to the breast, mouth to nipple, the nipple will end up on the sort of firmer, bonier structure at the front of the palate. If they go on nose to nipple, leading with the chin, so the wide mouth can open and they can come up and on, the nipple will go toward the back of the palate where the tissue is soft and spongy. Again, it's a nice little thing for you to do, is to sort of feel your own palate. You can do that with your tongue in your mouth, so kind of sweeping your tongue forward, going from the soft kind of spongy tissue at the back forward to where you feel it boning it behind your teeth. Or with clean hands, just pop your thumb into your mouth and feel around, so you can feel the difference in that structure and where it changes to soft. The nipple must be where the tissue is soft for your nipple not to get sore and for your baby to have an effective feed. And that's why these principles really help you set up that run up to the latch. So thinking about that triple jumper, that run up is close, head free, body and head in a straight line, and nose to nipple. Those 4 points, that's all we want you to think about. And you can use those principles in other positions. So we can still do close in underarm. We can still do head free in underarm. We can still do head and body in a straight line in underarm. And we can still do nose to nipple. And we can do that lying down, and you can do that in the laid back position. There's lots and lots of different positions you can feed in, but these points of positioning you can apply them in every single different position that you try. So always remembering those 4 things. Eventually you won't think about it, and it will be feel perfectly normal for you and your baby. So again, if we can just see, this is obviously some photographs of those positioning, those points of positioning in action. So we've got, first of all, baby is head free. We can see nice and close to mum. That tummy is pressing on her mummy, you know, she's really, really close, and mum's holding her in that beautiful way with that C-shaped finger at the base of her neck here. Her head is free if she wants to rock it back before she latches on, and also she doesn't feel pushed onto the breast now. She's got her head free, doesn't feel like somebody's pushing on the back of her head, and she won't keep pulling back. This is your sort of early position here, this number 2. This is where you're aiming that nipple towards the nose, and the baby is about to come in chin first here. Look, so chin first, leading with the chin, scooping that bottom lip down low. The nipple is now aiming upwards into the soft palate. Okay, so when the baby comes onto the breast, the nipple will be directed right to the back of the mouth. It's exactly where you want it. So again, this is just more pictures for you to see this in action. So we've got leading with the chin and nose to nipple. It does feel a little bit strange to do this positioning, but it is really important, and it's definitely worth having a look down and thinking, is my nipple aiming straight to the mouth? I want it to the nose, but at the point your baby opens their mouth wide, then the nipple will aim towards the roof of the palate. So we'll have a little look now at signs that your baby is feeding effectively. And it's really important actually, because positioning is what we've just talked about, but now we're going to have a little look at attachment at the breast. So these are kind of 2 separate things. Positioning is the run up, attachment is the jump, okay? So we're looking, is that has that been a really effective positioning to get a good latch. So it's the way the baby holds the breast in the mouth, and it's